Hello, class, and welcome to Chapter 1 Phlebotomy Practice and Quality Assessment lecture. As you know, with phlebotomy, we are responsible for helping the physician with clinical decisions, which are based on medical standards of practice, diagnostic testing such as laboratory testing and x-rays, a patient's history, and observation of signs and symptoms. Therefore, before a physician can make a clinical decision, they need laboratory test results for that patient. Since laboratory test results which influences the majority of medical decisions and plays such an important role in the clinical management of patients, many healthcare workers are taking greater roles in the specimen collection process. Among those who perform phlebotomy tasks are clinical or medical laboratory personnel, which include us as certified phlebotomists, nurses and nurses' aides, respiratory therapists, medical assistants, home health personnel, and others. And when we list those people, home health nurses do draw blood from their clients when they go visit the home. As far as nurses and nurses' aid, remember sometimes we collect specimens, meaning we go up to the floor and receive a specimen to transport to the lab. So nurses are really responsible for, sometimes they'll collect tissue samples or they'll collect wound cultures for us because we're not allowed to collect those. Same thing with nurses' aid. They'll collect urine or they'll collect a stool sample or they'll collect a sputum sample for us to transport to the lab. Now, most hospitals do have what we call most terms are called a caterpillar, but they kind of look like when we go to the bank teller, those pneumatic tube systems is what most hospitals have nowadays, to where the nurses can collect the specimen and shoot it down to the lab, but some specimens cannot be sent that way, and we have to walk up to the floor to collect them because if they're shaking in that pneumatic tube system, it distorts the lab results. So sometimes we have to go and collect and transport to the lab ourselves, which basically helps the doctor make a clinical decision as far as how to treat their patient to make them feel better. As we know, the term phlebotomy is derived from a Greek word meaning phlebot, which relates to the veins, and tomy, which relates to cutting. In ancient times, phlebotomy has practiced to withdraw blood using various means, including knives, crude lancets, leeches, which leeches are still used today to get rid of blood poisoning, blood cups or bowls, pumps, and glass syringe. In some cultures, phlebotomy was thought of to be as a cleanser or purifier of the blood, or to get rid of unwanted spirits. Back in ancient times, there were times to where they thought that if a person was possessed with an evil spirit, that they would bleed them out to make the evil spirit disappear. So I know a lot of y'all are younger, but Francis Coppola made Bram Stoker's Dracula, and they show a crude way of how phlebotomy was done in the beginning part of the movie, where they were withdrawing blood from a person and interjection fresh blood back into the person. It's just a crude way of them were doing some type of phlebotomy, which we call now blood donation. So, or blood transfusion. So they were doing it a crude way. Um, Not all the time these things worked out. Sometimes they would bleed out the patient too much, and the patient would end up dying anyway because they let out too much blood and the patient couldn't recover enough blood to survive. But as we know today, the current definition of phlebotomy can be summarized as the incision of a vein for collecting or blood sample, which a portion of blood is removed that is small enough to as not to cause any harm to the patient itself. There are two common phlebotomy techniques are extensively covered that are central to all phlebotomy practices. We are responsible for doing venipuncture, which is a withdrawal of venous blood sample from a vein and not an artery. We cannot stick arteries. Using a needle attached to a evacuated tube system or other collection device. And then we can also do skin punctures, or dermal or capillary, as they are also called, which is the puncturing of a finger with a specially designed safety lancet to withdraw a smaller amount of capillary blood from the patient themselves. Patient blood samples are described portions of blood taken from laboratory analysis of one or more characteristics to determine the character of whole blood. Laboratory analysis of a variety of specimens are used for three important clinical purposes. The first purpose is for diagnostic and screening tests. This is to figure out what is wrong with the patient, to detect any irregularities that may require more extensive follow-up testing if possible to see what is going on. Then we have therapeutic assessment. This is to check to see if a specific therapy or treatment is working on the patient, or to test to see if a particular drug is working on that patient. And then we have monitoring. This is to ensure that the therapeutic treatment that the patient is receiving is actually working effectively like it's supposed to be. Especially, we do monitoring if if a patient is on extensive antibiotics, like the strong stuff such as vancomycin, tozoplamycin, or vancomycin, tobramycin, gentamicin. Those are very strong antibiotics, and so we monitor to make sure that that antibiotic is working to ensure that it's getting rid of the infection that the patient currently has. And we also, those type of medicines also serve dual purposes, because it's not only that we have to monitor it to make sure that it's working, but we also have to do a therapeutic assessment also, because of the fact that if they receive too much of it, it can do more harm than it does good. So those type of things we have to monitor for when we're doing therapeutic and monitoring a specific drug on a patient. That's why we draw labs on. As far as phlebotomy practice, our duties vary in scope and range, because not only are we drawing blood or collecting and transporting blood, venous blood, we also sometimes have to also collect arterial blood, urine, tissue samples, or specimens that have to be also tested for a patient to receive the appropriate care. Not only that, us as phlebotomists, we not just draw blood. Sometimes we have to be also involved as far as the clinical, technical, and clerical functions of the laboratory too, because sometimes a doctor's office will call and the med techs are busy trying to get results out for the specimen. So it's our responsibility as a phlebotomist to kind of look up a patient and to give out results to the doctor's office. Sometimes we're responsible for that. Technical aspects, depending on what lab or what type of lab you're working for, sometimes you'll be responsible for doing urine testing, stool testing, sputum testing, helping with allocating blood into different tubes. And what allocating means is basically you're separating the whole blood from the serum, putting it in another tube to be transported to another laboratory for testing, because that maybe your lab doesn't test for that specific test and it has to go to another lab for testing. We're also responsible for point of care testing to a point, especially if you work in the outpatient services. Not so much in the hospital, because most of the time nurses take care of point of care testing, to where they'll test the patient's sugar level, they'll test the patient's lipid level, and they'll also test for their A1C, or that sugar level also. And as far as healthcare workers, home healthcare nurses, they are responsible. They go draw in labs, the labs on their patients. And when they say ambulance, they mean the ambulance driver will sometimes draw blood. Now, is it always adequate? No, because you got to remember that ambulance is bouncing around the road, and sometimes the blood doesn't get distorted. So if you look at box 1-1 in the textbook, these are potential job sites that a phlebotomist can work for. As you know, we can work in a hospital, which we call that inpatient setting. We can work for ambulatory care, which is what we consider outpatient setting. Some phlebotomists are lucky enough to work in a physician's office laboratory if they so have one. Depending on home health care, some insurance companies do hire phlebotomists to travel to draw blood for their patients just for their insurance clearances. That's what we call a traveling phlebotomist, because you travel to service these patients for the insurance company. And that right now is a growing industry in our field to where we can travel now. The only thing they ask, if you're like in a particular state, especially in the state of Louisiana, you have to get your state medical board license. And no, you do not have to take another test. Basically, you just have to prove that you passed your NCCT. And then you get certified as the Louisiana Medical Board when you do traveling phlebotomy. So healthcare setting and healthcare teams. It is very important to know the members of your healthcare team and to learn the specificity and sub-specificity areas of healthcare and medication. So basically, we know that a medical technician is the person who does the testing and sends out the results of the lab work that the phlebotomist has collected. That is their purpose. We know doctors are the ones who treat and diagnose the patient once he has acquired the results that the med techs have had resulted that the phlebotomists have collected. So the trend goes on and on and on. And we always have to know what each other's professionals are and what roles and responsibilities we have. Like our role as phlebotomists is to make sure we collect adequate and sufficient blood samples. And we also have to be responsible to make sure that while blood is being transported, that it doesn't get distorted or jostled or shaken up. It has to be transported correctly. Our other responsibility is also time. Just because you have 50 million you might have 10 patients to draw in that one area. You can't sit on that blood for hours and hours at a time, because as each hour passes, that blood gets distorted each time. The red blood cells starts breaking down. It is also important to learn what different clinical laboratories are for and what their functions are for as well. So if you look at table 1-1 in the textbook, it tells you which of the different departments are used for, what they test for, what personnel is in that area. So say for instance, we are more familiar with electrocardiography. Well, we know electrocardiography is responsible for obtaining EKGs or ECGs, depending on which doctor you. If it's a younger doctor, they'll say ECG. If it's an older doctor, they'll say EKG. And basically, we know that is to test the current flow of how the heart is beating. We know that in our electrocardiography department that we have a cardiologist, a nurse, and sometimes a medical assistant, and of course EKG technicians, because we're responsible for taking the EKGs. We do not diagnose, we just make sure our EKGs are accurate and precise. That's why we learn what rhythms are supposed to look like and when we have an artifact and when we don't have an artifact. It's not to say that we're diagnosing the patient to say, oh, you have an AFib, oh, you have an atrial flood. No, that's not our responsibility. That's the cardiologist's responsibility. Our responsibility is to make sure that when we look at our EKG, that we know it is a clear and precise EKG reading, that is not mumble jumble and a whole bunch of artifacts thrown everywhere. Now, if you are a telemetrist, then you have to make sure you really know your rhythms, especially your life-threatening rhythms, because basically you're looking at that patient's monitor for 8 to 12 hours a day to make sure that their heart is beating as according to what is their norm. And if anything abnormal comes up, it is your responsibility to call the nurse's station so she can check her patient. But you have to be distinct and confident in what you're looking at as far as a rhythm. That's why we go so extensive in EKG. As you know, the field that we're in right now, since we're in phlebotomy, is laboratory medicine and pathology. This is the pathology department because the lab is broken down into different departments itself. You have pathology, you have microbiology, you have blood donation, you have serology, and you also have your coags, your chemistries. Each department is broken down. Each lab in the lab itself is broken down into different departments in itself. So it's very important to know if you're collecting a coag that it goes in the coag department. If you're collecting a chemistry, it goes in the chemistry department. If you're collecting a RBO typing cross match, that it goes in the hematology / blood donor center. So to become a professional or mature member of the medical team, it's very important that you understand the mission of the organization and the goals of the group and project objectives. When you're hired into especially into a hospital field, say for instance, if you get hired at Lourdes, well, Lourdes being that it is a Catholic-based hospital, they follow the Franciscan missionary rule. And it's very important that you understand the Franciscan missionary rule, which is to be kind and courteous to all patients, no matter how they treat you. You must always be kind and courteous and forgiving and understanding to all patients. That is their mission. To service the patient to the best of our ability in a kind and Christian services. That's the mission of Lourdes. At Lafayette General, they have to practice what they call aided. Aided is you have to greet each and every patient with a smile and a courtesy. It's almost similar to what Lourdes is, but theirs goes a little further because that means it facilitates throughout the whole hospital. It doesn't matter if you run into another coworker, you're supposed to still greet them and with a kind and courteous smile and at least acknowledge that they're there. No skills of team dynamics, active listening, group norms, etc. The reason why we have to practice active listening, because sometimes a doctor will send a patient, especially if we work outpatient, which is ambulatory. If you work outpatient, sometimes the doctor send a patient emergency-wise to outpatient to get labs done, and not all the time they remember to give that patient their lab orders or their lab slip. So sometimes their nurse will call us and say what labs the doctor wants. And it's our responsibility to actively listen to what tests the nurse is dictating to us, and to also get that patient's information correctly. We have to get the patient's first name, last name, first name, date of birth, what insurance they have, their patient ID number, what doctor is ordering this specific test. We also have to make sure we have the test that the doctor wants accurately and correctly. And we also normally, once we received all that, we have to do what we call a read back, meaning read back everything that the nurse has told us, read it back to them to make sure we have accurately written everything down correctly. That's active listening. Understanding relevance and commitment to team goals. It's always, especially in the lab, the main and majority goal is accuracy, conciseness, and turnaround time. Those are the things. You can have all the speed draws you want, but if your tubes are coming back inadequate and you're having to recollect, that's not a good thing. Speed is good, accuracy is better. You can be slow as you want, as long as you're not slow as molasses and your blood still becomes distorted. Accuracy is the key. Speed comes in time. Show reliability and dependability in work assessments. That's basically saying that if you make a mistake, own up to your mistake, because that's somebody's life you have in your hands, I should say. Especially, that's why we always double check and triple check to make sure we draw the correct patient, because drawing the wrong patient and that patient receives the treatment that was supposed to be for another patient can cause fatality in most cases. Not all cases, but in most cases. And sometimes it's irreversible, even if they catch it in time. So own up to your mistakes. Don't be afraid. Dependability, meaning you are able and willing to work independently and dependently, meaning you're not going to shy away. If it's a busy day in the lab, you're not going to sit there and play ghost, is what I like to call it. Go play ghost, meaning go hide in a corner somewhere for a couple of hours until it slows down, and then come back and say, whew, we had such a busy day, and you haven't drawn not 2 patients the whole time that the lab was busy. That's what I call playing ghost. Be reliable, be dependent, be assertive in your job and in your work ethics. Always actively communicate your ideas and respectful participant in decisions. There are some things when the lab that sometimes change, sometimes for the better, sometimes for the worse. If you feel that this is not going to work, especially if you're working in an outpatient atmosphere, which is what I've worked, well, I worked both a lot of times, in-house and outpatient. But especially in an outpatient setting, outpatient is very active. I'm not saying in-house isn't active, but outpatient is very, very active. We constantly have different diversities of patients that come in to outpatient to get their labs done. And sometimes our supervisor would come up with an idea and we try it for 1 or 2 days and we're like, no, this is not working. And we weren't afraid to communicate to say, no, this is not working. We need something else. We need to try something else. Always learn to be flexible, because flexibility is the key to don't be afraid of change. Change happens all the time. Sometimes you might be drawing a specific test in this color tube, and then a couple of months later, they'll say, no, we want it in this color because we find that it is more viable in this color tube. So don't be afraid to be flexible with change. Constructive, manage conflicts. Don't have a screaming match with your coworkers. It's not professional. If you have a problem with your coworker, try to solve it as an adult. And if the conflict still proceeds, bring it up to your supervisor's attention so that y'all can have a one-on-one with your supervisor and try to clear up the atmosphere. Don't have an open-faced confrontation in front of everybody in the lab, or especially not in front of all the patients themselves. Always contribute to cohesion of the team, meaning always put your best foot forward, or try to put your best foot forward. Contribute to problem-solving strategies. If you have a conflict or problems within the lab, always try to maintain or contribute to some solutions to where you can better make the lab effective. And always support and encourage other team members, especially new team members, because believe it or not, your first day at work and you were nervous and you didn't know anything and you didn't know anybody, always encourage that it does get better with time. It does get easier. It does get better. Always being encouraging and helpful to your coworkers. Clinical laboratory and specimen collection services. As you know, that a typical hospital-based clinical laboratory has two components. You have your clinical pathology and your anatomic pathology. In your clinical pathology area, which is also called your clinical laboratory or medical laboratory, this is where blood and other types of blood, body fluids and tissues are analyzed, such as urine, cerebrospinal fluid, sputum, gastric secretions, and cervical fluid are collected. In an anatomic uh, pathology area, autopsies are performed, histologic and cytologic procedures are utilized for tissue and fluid specimens, and fine needle aspirations and surgical biopsy tissues are analyzed in an anatomic pathology situation. These are some of the agencies who are responsible for laboratory services. These are federal government, which has agencies to help regulate and oversee all clinical laboratories. One of them is the U.S. Food and Drug Administration, or the FDA. The other one is the Center for Medicare and Medicaid Service, or CMS, and the Federal Department of Health and Human Services. You also have the Occupational Safety and Health Administration, which is OSHA, in the Department of Labor and Department of Transportation, which is the DOT. We also have CLIA, which is the Clinical Laboratory Improvement Amendment. Um, Clinical medical laboratories. Clinical laboratories, especially those that are in a hospital base, typically have administrative offices held by a pathologist and our director who oversees the many financial and operational aspects of the laboratory. We have the administrative responsibilities include all the financial matters such as cost accounting, budgeting, as well as human resources, strategic planning, operational issues, and regulatory issues. And then, depending on the size of the lab, labs are also can be broken down into multiple supervisory or management personnel and physician or scientists overseeing specific areas of the clinical laboratory. And then you have your even larger hospitals that may have your technical experts and staff performing tests and reporting results, which is usually your medical technicians or your med techs, as we call them for short. All right. So, um, laboratory personnel work as a team to provide essential clinical data to physicians for diagnosing, testing, and monitoring patients. That is our goal. They provide the many pieces of a complex puzzles that make up a patient's condition. Laboratory professionals have some common characteristics. They like to solve problems. They strive for accuracy and reliability in their job tasks. They communicate well. They work under pressure and follow through on complex tasks, and they set up high quality standards for themselves and their work. Right. As far as phlebotomy education and certification, as you know, when you're going into the field that we are in order to get admitted or in order to come into Unitech, the first thing admissions usually ask you is if you have obtained your high school diploma, that are something equivalent to your high school diploma, such as your GED, before you can even enter into a technical college for Pacific or job training college for Pacific field, especially in phlebotomy. Your length of training, as you know, if you are a day student, it's 8 to 9 months, and if you're an evening student, I think it's 10 to 11 months for training purposes. Now, some schools say within 8 weeks you'll become a certified phlebotomist. But as you can see from the extensive training that we do, or how in depth we go, as you can see, how is that possible that you learn everything within 8 weeks? It's how I'm still amazed on how that works out, which I'm still astonished and still amazed about. Um, and as we all know that we have to pass a national certification examination in order to work as a phlebotomist or EKG tech. And to pass certification, you have to score a 70 or above on your certification test. As you go through your career as a phlebotomist or EKG tech, you will be also obtaining what we call continuing education programs, due to the fact that phlebotomy and the medical field in itself is always constantly changing. New things always come up. I try to keep up with everything as I'm teaching a course to make sure that you're up to par with everything. I still communicate to a lot of people that I worked with before in the field that are still in the field. Some of my former students call me and tell me that there's a new technique that they do also, or if they do something different. These can be either obtained. I know NCCT usually sends you out now it's email. They send you out an email saying that it's time to do your continuing education credits. It's not to say that you're taking a test all over again. Usually it's just a pamphlet, a little book you have to read and take a short little quiz, and they score you on that. Do you have to still pass it? Yes. Because once you pass it, they send you a sticker to stick onto your certification card saying that you have completed your CE accreditation hours and that you have passed. Sometimes you can do it online through either a college or university, or you can go through a professional conference and acquire it that way also. So if you take a look at table 1, 2, and box 1, 4 in your textbook, it shows you boxes. Box one. I'm looking through the old book. The new book is different. Now, when I'm telling you these boxes are these, this is based off of the edition 10 phlebotomy book. It might be a different page or a different box in the older book, and I'll send out a little message to see which one it is. Right. Professionalism. Everybody pretty much has bit of what professionalism is. Professionalism is the skill, compliance, or character expected of an individual in a trained profession. You are responsible to act a certain way within the scope of your field. As phlebotomists, we are required to be kind, courteous, and polite. We are never to be evasive, rude, or give a care attitude, because the whole purpose of that is if you show up and you have this mean look on your face, most patients take offense to that, is to say, "Ooh, do you really like your job?" It's basically how they look at it. And sometimes they might take that as a negative approach. And um, nowadays, hospitals are based off of customer service. This is how you get your bonuses for the end of the year. It's based off of patient surveillance. So if you have good patient surveillance, that means your bonus can be higher than expected. Customer service is the key. Good customer service, not just customer service. Excellent to extraordinary good customer service is the key. So you always must be respectable. You must be supportive. You must be able to be able to grow within your prospective field, and of course, you must be able to service your patient or client. Professional organizations for phlebotomists are the American Society for Clinical Laboratory Services Science, American Society for Clinical Pathology, National Honor Association, National Healthcare Association, and there are many others. If you look on the box, one, they give you a list of all the professional organizations just for phlebotomy in itself. Ethical standards for phlebotomists. Our number one rule as a phlebotomist is to never ever do harm intentionally. Yes, I know we are sticking a patient with a needle. Yes, it is going to hurt, but um, we have to be respectful enough not to intentionally do any bodily harm to a patient on purpose. Perform according to the sound technician ability and good judgment. Basically, as you know, we do prep a patient before we just blind, and I call it blind sticking. We never ever blind stick a patient. And when I say blind stick, I'm not saying that you basically have to see the vein, but you do have to make sure you can feel the vein. That's not a blind stick. If you can feel it, you can stick it. Is how I say it. As we know, we prep the patient before we even insert the needle into the patient's arm by palpitating to find a vein, a good accurate vein. We also tell the patient exactly what we're doing, explain the procedure to the patient. Before we can even do any of those things, we always have to respect the patient's rights with confidentiality and privacy, right to know about what they're being treated for, and they also have the right to refuse treatment if so said. With that being said, um, before we can even get in a patient's personal space, we have to make sure we explain what we're doing. Um, they have to give consent in order for us to draw. And if they refuse, they do have that right to refuse. But um, if the patient decides to refuse lab work, we also, before we can even leave off that floor, we must inform the nurse and have it documented. Documentation is the key to keeping your job secure, because if a doctor calls and says, why my labs haven't been drawn, and you as the phlebotomist say, well, the patient refused, and he goes to the nurse and says, have you been informed that the patient refused? And the nurse would be like, no, I saw the lab tech go in. I thought she drew the blood. Cover thy own backside is what I say. So if a patient decides to refuse a lab, make sure you inform the nurse on duty who's responsible for that patient to say that the patient refused labs and to get her to sign to initial the lab slip stating that the patient refused labs, because it becomes a he say, she say situation. And that's what we try to avoid, especially when it comes to the doctor saying, why didn't you draw? Patient refused. Well, you told anybody? No. So that's when you have to make sure you document it. In that instance, characteristics of a phlebotomist is to always show sincerity and compassion towards your patients. Basically, a phlebotomist should possess an intense desire to service people and show interest in learning about blood and specimen collection practices. You must have emotional stability and maturity, because us as phlebotomists, we cope daily with seeing other people in pain, handling blood and body fluids sometimes, facing injury and traumas. Sometimes we are called into the ED to do a trauma patient, and if you can't handle seeing somebody's broken up or bleeding out or screaming and hollering or convulsing, then you can't. You got to be able to handle all those intense situations. Because in a trauma situation, it's not just you in that room. It's you, the doctors, the nurses, respiratory, x-ray, EKG techs. They're all in one room and you're fighting to get space. And you have to be precise, consistent, in out situation. You got to do your job and do it right and be fast and accurate and not stand there like a bump on a log and just stand there going, sometimes you might see somebody pass away right in front of your eyes. I know there was a situation I was drawing a patient's blood, lab work. All of a sudden they coded right when I was in the room. All I heard was beep, and I'm drawing blood. I'm in the room, and they code. Nurse came in, still doing, had to do crash cart, everything in the room. I'm still drawing, because why? I had to get his labs. I just happened to be, I guess, at the right place at the right time or wrong time. I don't know. Anyway, as you look at it, but we come into situations where we have to do all those. Always have accountability for doing things right. If you make a mistake, don't be afraid to say, I made a mistake. You might mislook at a label and it says CBC, and it goes in a purple top. Well, not yet, but you will. A CBC goes in a purple top. Well, you might mistakenly draw a light blue top for CBC. Oops. Don't be afraid to say, oops, my bad, and go back and do the correct tube. So it's always good to be truthful. Make sure you wash your hands between each patient. That's a give me. If you can't wash your hands, I always used to carry a small bottle of hand sanitizer with me until I can get to a sink and water and soap after I would draw a patient. Because the one thing you don't want to do is transport an infection to another patient due to unsanitarianism. Dedication to high standards of performance and precision. A phlebotomist must continuously upgrade and maintain the quality of their skills and seek out knowledge about new techniques they may come into play, and new safety procedures that may be formed, new types of equipment and supplies that may be introduced. Always be up to date in computer technology through your CEs. Sometimes hospitals do change programs, so therefore we have to be more trained as far as how the new program works in ordering labs, or how to process your tubes into the system so they can get tested. Respect for patients, dignity, privacy, confidentiality, and the right to know. Confidentiality and the right to know. As we know, we have to be confident. We can't go blab all over the place saying, "Ooh, girl, you know, so and so in room something something is getting tested for HIV." That's not nobody's business. That's nobody's business but that patient's business. And you are just a phlebotomist who is drawing the labs. That's all you do. That's your responsibility. That's what you do. That's all you do. You're not supposed to blab out to anybody what's going on in that patient's room. That's the patient's confidentiality and their privacy. The right to know, that's a gray area. Yes, a patient has the right to know what labs are being drawn on them. Yes, they do. But if that patient has a guest in the room, we cannot disclose what tests are being done, because what if it's a test that they don't want their family members to know what's going on? So in a situation like that, if the patient wants to know, well, what labs are you drawing for today? Sir, I'm just here to draw your labs. If you want to know what specific tests that you're being drawn for, your nurse or your doctor will be more than adequately to answer those questions. That's simply all you have to say. Because as long as there's somebody in the room, we cannot disclose what type of tests we're performing. All we can say is we're here to draw labs. Your doctor ordered these labs. If you want to know the specific test, you can ask your nurse or your physician whenever they come in to check on you. And that's all we have to say. Now, if they're in the room by themselves, then yeah, we can tell them what tests we're doing on them. Cleanliness, or acute attention to cleanliness. Phlebotomists must protect themselves and patients by according to sterile techniques. Good personal hygiene and cleanliness affects safety and the quality of healthcare. Um, always, um, always wash your hands after each patient. As you know, always wear gloves. Do not pop the finger off the tip of your glove. You're just contaminating your patient and yourself along with it. Always make sure, say for instance, and I'm not saying it only happened to me once. I had a patient who they were severely anemic. So sometimes with anemia, your blood is super thin, and they had a very good heart rate. And by the time I took the tourniquet off, it took the needle out, I got a little squirt on me, on my uniform. If that happens, you're supposed to go and change out that uniform right away. You call your supervisor and say, "Hey, an accident occurred. A patient, squirted me with blood on my uniform. It didn't get anywhere else, just on my, uniform." And what they'll usually do is tell you to, take off that uniform top and go to what we call SPD, which is where they have extra scrubs for you, and that they usually have for surgeons, because they sterilize them and wash them. And what they'll do is they'll give you a temporary top to use to finish out your shift. As long as it doesn't touch your person, you're still safe. It's when it gets on your body, that's when they go and test to make sure that the patient doesn't have any infectious disease. But if it falls on your clothes, because 9 out of 10, you're going to have a lab jacket on. So you're supposed to have a disposable lab jacket on at all times anyway. But it just happened to where the lab coat was, just exposed it right there. It got on my scrubbed out. Characteristics, pride, satisfaction, and self-fulfillment in the job is the key. I always went to work every day especially when I was on the floor, is to say that I'm improving somebody's life today. I'm saving somebody's life today. Whenever I go into work, I always go in with the attitude as to say, what if this is my family member and I want to know what's going on with that person? Or I want to help the doctors make sure they get this person feeling well. That was always my key to being satisfied and being proud about what I did every day. Always remember there's no such thing as I in team. Everybody works as a team member. If for some reason you cannot draw on this patient, you have tried your 2 sticks and you still haven't received any blood or you wasn't able to get it, always make sure you call another team member up to the floor before you leave to see if they can possibly get some blood drawn from this patient. Because you never just want to leave a patient without getting your labs completed. And always take pleasure in communicating with your patients. Never leave dead air or dead silence. That's what makes a person nervous. And if a person gets nervous, it can affect their lab results also. So you always want to be able to communicate. But there are rules to communicating with your patients. There are 2 things we do not talk about to a patient, and that's politics and religion. And I know I worked in a Catholic hospital, but there was just certain things we did not talk about. We don't talk about politics. We don't talk about religion because everybody has their own views and beliefs as far as those 2 things. So we can talk about the weather. We can talk about the fight last night. We can talk about the football game, anything else but politics and religion. As far as you being a professional and a phlebotomist, it's very important that you have appearance and grooming and physical fitness that go along with it. As you know, most healthcare organizations have rigid policies about what to wear in the workplace. Keep in mind that style and creativity are not key goals of most dress codes in the healthcare field. Um, as you know, Lafayette General has pea green or olive green as the color for phlebotomists. Uh, OGH has red. So if you work at OGH, you're in your red scrubs again. Um, 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 Telecris or Griffles, I think their uniform is navy blue, I believe. I'm not 100% sure. I know at Lord's it's royal blue. You look like a Smurf, as I say. So it's not appearance as you can see in school itself. Us as EPT, we wear red. MA wears black. Um, Pharmacy wears burgundy. So every dress code, it's a dress code according to your department that you're working in. Posture is always a key to see how well you are confident in your job ability. So if you enter a patient's room and you hunched over and you just had the slumpy shoulders, that gives off a signal to the person that you're not very confident in what your abilities are and what you do. It gives off that signal. And you may be the best phlebotomist in the world, but the way you walked into the patient room dictates something else. Uh, Grooming and personal hygiene, as we know, wear deodorant, take a bath, make sure your hair is combed, make sure grooming, personal grooming, hygiene, clean, effective, you know, professional. Personal protective equipment or PPE. If a room dictates we have to wear personal protection equipment, please wear your personal protective equipment. Now, working in the lab, we always have a lab coat on. That's to prevent any mistakes or anything spilling on us. we always have a disposable lab jacket on. You don't have to buy a lab coat. There's always disposable lab jackets in the lab at all times that we are supposed to wear at all times anyway, because we are dealing with body fluid, we are dealing with blood, and we don't want that to spill on ourselves. So we always have that on. And of course, dress code is according to what facility you work for. They'll tell you what color scrubs you need for that particular department or that particular facility. And always make sure that it's iron pressed and wrinkle free. You don't want to walk around with wrinkled clothes on. That doesn't show good professionalism or good quality that you take care of yourself. As you know, in the medical field, it can be very stressful and very tedious and very mind blowing, especially during times of when you may be have a rotation and you're working the ED for so many days. And believe me, working in the ED, you do see a lot of things, especially if it's a busy day. You see a lot of things. So it kind of wears on you after a while. It's not to say that you don't like your job. It's just that after a while, your stress level can go up unless you take care of yourself. Always remember to take care of yourself. Take time off for yourself. Don't be afraid to take a vacation. There are other phlebotomists. They have PRNs who would love to take your spot for that particular time, just to say they have a little more hours. PRN means they're on call, meaning they're only there when needed. So if you need to take a break, take a vacation. Always find humor and optimism in what you do. Laugh. If there's a time to laugh, laugh. Make sure you do some type of exercise. Even if you are on your 30-minute break, go outside, walk around. Don't stay cooped up in the hospital. Go somewhere, walk around. Make sure you always eat. You never want to work on an empty stomach. Make sure you always hydrate. You eat, and always control the source of stress. If possible, you know, if if you are easily stressed out, just remember there are different techniques to help alleviate stress that you can acquire in your day-to-day workday. Make sure you sleep when you're off of work. Go to bed, go to sleep. Find another hobby for yourself besides work. Avoid harmful habits. Harmful habits are like every time you get off of work, you gotta go get a beer. Or every time you get off of work, you gotta go and um, nicotine, smoke a cigarette, drink a beer. Something harmful you want to try to stay away from. And if possible, if things get a little too monotonous or too overwhelming, always seek professional assistance. Most hospitals do give free psychic analysis, especially if you work for the hospital and you go to one of the physicians that's under that hospital's umbrella. They offer you psychiatric help for free. It's not, you don't have to pay for it out of your insurance compensation as long as you work for that hospital. Because what we see on a day-to-day basis does tend to wear on the psyche from time to time. It's not to say that you can't handle it. It's just sometimes it becomes overwhelming, and sometimes we just need to talk to someone else about what's going on in our day-to-day life on the floor. All right. Quality assurance, control, improvement, and assessment. This is a pretty big right here because quality control and assessment is the key to performing our job to the best of our ability. Um, Perceptions of quality. The concept of quality can be described in a variety of ways. The Clinical Laboratory and Standard Institute, or CLIA, which is an organization that develops consistent standards for laboratory practice, defines quality as the degree in which a set of inherent characteristics fulfills requirements. Other definitions include terms as excellence, high standards, superiority, and the degree to which a service is performed correctly. One can also consider quality in healthcare in two categories. So the first category is the scientific or technical aspect of quality, and then the other is the non-technical or interpersonal aspect of quality care. Um, Whereas quality in healthcare uses three major concepts. You have efficiency, which is the healthcare service provides a positive impact on the patient's health. That is, the patient improves or gets well. Then you have appropriateness, which is the procedure performed on the patient on the correct ones for that particular condition or illness. And then you have caring function, which is the service provided to the patient are available timely, effective, safe, efficient, respectful, and sensitive to the patient's needs. The quality of phlebotomy services focus not only on meeting a minimum standard, but also on the process and assessment to consistently improve on the services that are provided to stakeholders or customers. Stakeholders or customers are individual groups, organizations, or committees that have interest in or influenced by the quality of healthcare services. So they can be external, which external stakeholders or customers are individuals or groups which are outside the organization. And of course, you have internal stakeholders, which are individuals or groups within the healthcare organization. Externals are our patients, are shareholders who have some kind of stake as to where how the facility runs. Internal are usually organization of doctors who are responsible for this particular type of facility. Some are physician ran, some are privately ran. Quality incentives. You always have some type of code of ethics in in a healthcare setting. We're always evaluated to make sure that our credentials are up to date and that we are continuing a positive performance. And we're also making sure that we are always up to par as far as with our continuing education levels. So we always have to follow our standards of practice, which are complied by CLIA. We also have to make sure that we are always up to date as far as our clinical programs, as far as our CEs. We always have to make sure that our licensures or our certifications come from an accredited association. We always have to make sure we have continuous quality improvement, or CQI, which is the concept of meeting and exceeding customers' expectation by resolving immediate problems and finding opportunities for improvement where problems do not currently exist. Then you have your Six Sigma, which is a method designed to improve process performance by reducing variation, improving quality, enhancing financial performance, and improving customer satisfaction. So basically, it provides a data-driven, systematic approach to quality management through 5 phases, sometimes abbreviated as DMAIC, which basically DMAIC is broken down into define the problem, which is to define the problem, measure and analyze, improve, and control. So DMAIC breaks down into define, measure, analyze, improve, and control. We also have to follow globalization and standardization organization, or internal organization of standardization, which is the ISO. ISO is a non-government network of standard institutions from 155 countries that develop standards for manufacturing and services industry. The ISO standards provide a reference framework or common technical language between suppliers and their customers, which facilitates trade and the transfer of technology between them. So basically, they help communicate with other countries. It forms a concise thing. So it meets the leadership, the engagement, and the customer focus as a group, as a unified group under one constraint of regulations and policies. Okay. So another one is the Clinical and Laboratory Standards Institution. They also provide quality management guidelines and regulations as far as policy, as far as how we process, and how procedures are documented. Most laboratories have to follow this guideline and regulation. We also have to be mindful as far as our quality control program. We must have risk assessment. We also have to make sure we have some type of quality control plan, and we have to find a way to assess our quality performance. So us as an individual, we have to have certain quality control plans for ourselves. As we know, we have to always be reliable, we have to be accurate, and we have to be precise. So quality improvement effects for phlebotomy services usually focus on pre-examination, pre-analytical issues. For example, the healthcare workers technique, patient identification procedures, waiting time, complications, recollection or repeat venipuncture rates, multiple sticks on the same person, duplicate test orders for the same person. So we have to follow a certain quality improvement ourselves as dealing with issues and problems, and to be able to resolve these problems and to make sure we have good quality assessment as well. So us as a phlebotomist, if we notice and we see a set of orders and we know this patient had these orders already done, it is our responsibility to make sure that it's not a duplicate order, or to see why this particular test is being run again in the same day. So we have to find out to make sure that it's not a duplicate order in itself, that it just repeated by accident. We have to find out the why. We try not to do multiple sticks on the same patient, basically meaning if that patient had lab work done and we have to make sure that we collected specifically how the orders are done so we don't have to repeat a multiple stick on that patient. Sometimes recollection does happen. There's nothing we can do about it. It happens. It's for some reason the blood came out too slow and it hemolyzed. Sometimes we do have to recollect, and we can do about it, but recollect on the patient. Tools for quality performance assessment. We always have to be analytical. Clinical laboratory scientists and technicians use data collections to always ensure that our tests are adequate and quality. Time sensitivity. If you have a time test, make sure you collect that test on that specific time. If you have to draw a test, say at 10 o'clock, at 10 o'clock in the morning, it is 10 o'clock. Being that all labs run on a 24-hour clock, we do military time. So if a lab test has to be collected at 10 a.m., make sure you collect it at 10 a.m. and not 10 p.m. or 10:30. No, you have to collect it at 10 o'clock. It's time sensitivity. It's a sensitive test. It has to be collected at that specific time. Precision and accuracy. Basically what that means, if you have to fill a whole tube, fill the whole tube. Don't come with a little clear little bottom half of it and say, oh, that's precise and accurate. No, it's not. You can't run any. How much serum do you think you're going to get from that little bitty drop of blood? You can't run an accurate test on that. And 9 out of 10 is it'll be hemolyzed anyway because you didn't get a full tube of blood. Tools for quality performance assessment. We always have some type of tool for implementing continuous quality improvement, and they can include such things as brainstorming. This is a method used to stimulate creative solutions in a group. By brainstorming, we're just throwing out certain ideas and trying to come up with the best possible solution for that particular problem that we need to solve or before it becomes a problem. Sometimes we create flowcharts. This is just a visual representation of the steps or decisions that are possibly can be put into place to make sure that we have good quality for procedures for people to understand. And then you have the Platro chart. And basically what the Platro chart is it's basically a bar chart that shows the frequency of problematic events that reoccur, so we can help find a solution for that particular problem and where it's coming out from. And then you have the cause and effect. The cause and effect, and what this diagram does, it identifies the interactions among equipment, methods, people, supplies, and reagents. It's almost like brainstorming, but this tool is like the early stage of quality assessment when figures are figured out for a possible factor that can create a problem. It hasn't happened yet, but it's a possible problem. And of course, we have flowcharts, which is oh, I don't know. Right, and this just breaks down the different charts. Um, Plan to do check X cycle. This cycle is for assessing and making positive changes, then reassessing them. So basically, you get a to-do list, a honey-do list, and then they'll go back and recheck to make sure that this to-do list has done what it's supposed to do and to correct the problem by facilitating other charts into the to-do list, such as to-do Line graphic, histograph, and scatter diagrams. These are picturesque images that represents performance trends. They are used for charting numerological data distribution and are usually used after brainstorming and the cause and effect diagram has been explored. And then you have the checkpoints and tally sheets. These are structured, prepared forms for collecting and analyzing data for each attribute and reason. Then you have your control chart, which your control chart is basically a graph used to plot data over time, which is time of day, or hours, or minutes, days, months, etc. They are used for three important lines. You have the upper control limit, the lower control limit, and the average control limit. And these lines are established based on historical data and standards of acceptable practice. So your control chart is what you can control. It's basically what is controlled, and it's monitored over a certain amount of time to see if compliancy and quality are working. Some negative impact that can occur, which are usually preventable, is misidentification of a patient. That's why we always ask the patient, if we have a lab requisition or a label in our hand, we always ask the patient to tell us their first and last name and their date of birth. Especially in South Louisiana, in the older generation, because Lord's mostly deals with geriatric patients, you run into a lot of Mary Elizabeth Hebert or Mary Elizabeth Broad or John Joseph Hebert, because back in the day, your grandparents' time or your great grandparents' time, it was always believed that you had your first name and everybody had some type of saint was the middle name. So, and then you have the last name, and we do have a lot of Heberts, Broussards, or in Babineaus, Thibodeaux. So you might have a lot of Mary Elizabeth or Mary, what's another saint's name? Can't think of one offhand. But you have some type of saint's name as your middle name, especially in the older generations, and you might have a lot of them. So misidentification of a patient does come into play, especially in South Louisiana, where that aspect comes in. So it's very important to always ask the patient's last name, first name, and birthday. If for coincidence chance they do have the same name and same birthday, we usually have to go by the patient ID number, which is usually found on their armband, which we have to identify the patient by. Hospital-acquired infections due to poor cleaning techniques. That's why it's very important to always wash your hands after each patient, because we never want to transport an infectious disease to another patient who might not be infected in the first place. Poor venipuncture techniques that cause pain and nerve damage. Always remember, a vein is spongy, a tendon is cordy. It feels cord, it's tough, it's cord. Don't stick a patient in a tendon, and the patient will feel it because they'll get a numbing sensation in their arm all of a sudden, a numbing, tingling sensation, and it'll cause pain. Lengthy waiting time, rude behavior, or messy work sites. That's the one thing as a phlebotomist we cannot have at all. That leads to unprofessionalism, and it leads to mistakes, and it leads to tubes being misplaced. You say you draw this patient, so where's the tube? Well, why can't you find the tube? Because your work area is messy. Always make sure your tray, your phlebotomy tray, is always clean at all times. Waiting time, like I said, accuracy and dependability is done on turnaround time. It's done on waiting time. And who wants to deal with a phlebotomist who has rude behavior? I'll tell a phlebotomist quick if they come in with an attitude, can you send somebody else in here, because you're not sticking me, because if you're rude and you acting like that, that means you had 9 out of 10 times you're going to hurt me, and you're just going to stick, and that's not how phlebotomy is supposed to be. There are different phases of laboratory testing procedures that we have to follow. These procedures are as follows. You have pre-examination, examination, and post-examination. Pre-examination is when we are collecting the specimen. Got it? That is when we get our orders and we collect the specimen. Examination is when we transport it to the lab and it's being tested. Post-examination is when it's being resulted out and the doctor has the results. I'll go through it again. Pre-examination or pre-analytic is the time we get our orders and we collect the blood sample. Examination or analyzation is when we go and the med techs, we transport it to the lab and the med techs are running tests on it. Post-examination or post-analytic phase is when they are sending out the results so the doctor can diagnose the patient. Okay. Basic requirements for a quality specimen. We always have to remember we have to use standard care proportions. We always have to make sure that our specimen is collected on the correct patient and in the correct tube, which is the next one, collect anticoagulants and preservatives, meaning the correct tube. We always have to make sure that if the patient was supposed to be fasting, that it's collected in a timely fashion, that we don't make the patient wait too long before they can eat. And if it is a fasting sample, we have to make sure that that patient was fasting, meaning they hadn't had anything to eat or drink that day. We must label, handle, and transport patient specimens accurately and in a timely manner. If a specimen is supposed to be placed on ice, we place it on ice. If a specimen is supposed to be protected from light, we protect it from light. When they say handle, we're not supposed to jostle, tussle, throw the tube on the ground or anything like that. It's supposed to be handled appropriately. Labeling is making sure that we label the correct tube to the correct patient and we don't mislabel that specimen. That's why we always have to make sure we label the tube in front of the patient. And as we're labeling that tube, guess what we're doing also? We're re-verifying that patient again. So your last name is this, your first name is this, and your date of birth is this. We're saying it as we're labeling it. We also have to make sure that we collect time specimens on the correct time and that is documented that we collected it on the right time. Specimens that don't have an anticoagulant, which anticoagulant means no clotting agent or no coagulation in it, that we at least get it to the lab within 30 minutes. We do have up to an hour, but 30 minutes is the minimum time, no longer than that. Some future trends in phlebotomy practice are, as phlebotomy changes, as the world changes, our standardization and globalization organization does change rules and regulations as times change or as things change. Electronic medical records are that is a norm now. Very few things are actually documented now by hand. Everything is pretty much computerized. Some places have smaller, faster laboratory testing, such as POCT testing. There are some things we can actually test as a point of care testing agency that we don't have to necessarily draw a full tube of blood for, which brings me up to point of care testing. And then we have direct access testing, or DAT. Direct customer availability, robotics, drones. As you know, there are some surgeries now, to where it goes in with a mechanical hand to correct the heart valve. It's not necessarily the doctor automatically popping open the chest anymore to put their hand in there and stitch it up. And, sometimes it's just a little robotic hand, or and it's just a little bitty incision to where they can correct any minute little thing within the heart now. Education and accreditation, as you know, as the more you work in the field, the more continuous education goes. And we have to make sure we're up to date in our C's. And this concludes Chapter 1's lecture. Please be informed and make sure that you complete all assignments and everything. And this is it. Thank you and have a nice day.